Hello everyone, I'm Dr. Radhika PM, Associate Professor from Ramaya Medical College. Today we'll be discussing about the clinical anatomy of foot. Disclaimer, all the images and videos used in this presentation are from textbooks of anatomy and various internet sources. The images are used for teaching learning activities only. The video is done to help the undergraduates understand the clinical anatomy. I acknowledge the ownership of the images and give complete credit to them. Coming to the specific learning objective, the student should be able to describe the clinical anatomy of foot. So first coming to the clinical case 1, a 20-year-old man was disqualified in his medical examination of the army due to his flat foot. So what are flat feet and what is the anatomical basis of it? So the absence or collapse of the arches leads to the flat foot. So here you can see this is the normal healthy foot where you can see the arches, that is the median longitudinal arch. But in this case you can see that there is no medial longitudinal arch. So there is a collapse of arch which leads to flat foot. It is also called as the pes planus. It can be congenital or acquired. Flat foot persons cannot run fast as the arch foot people. So that was the reason why the person was not qualified for the army selection. Coming to the anatomical basis, during long periods of standing, the plantar aponeurosis and the spring ligaments are overstretched, which leads to loss of support of the head of the talus. So the head of the talus is pushed between the calcaneum, this is the calcaneum, and the navicular bone, leading to the collapse of the medial longitudinal arch. So what are the effects of flat foot? So there's a loss of spring in the foot, leads to the clumsy shuffling gait. There is a loss of shock absorbing function of the medial longitudinal arch. There is a loss of concavity leading to the compression of the nerves and vessels. This results in the neuralgic pain in the forefoot, which is called as the metatarsalgia. So these are the clinical features or the effects of the flat foot. Next, coming to the high arch foot, or also called as the pes cavus. In this condition, there is an exaggeration of the longitudinal arches of foot. So this is the normal arch, and here you can see the longitudinal arches increase. This is due to the contracture at the transverse tarsal joint. Next, coming to the second clinical case, a 3 days old neonate was brought to the hospital with a deformity of both the legs since birth. On examination, the foot was turned inwards and downwards. The deformity is painless and there is no history of trauma or swelling. So what is the diagnosis? So it is a club foot, or also called as the talipus, which is a birth defect in which the foot is twisted. There are 4 types of club foot. First one is the talipus equinus. So this is the talipus equinus. The second one is the talipus calcaneus. Here you can see this is the talipus calcaneus. This is talipus varus. This is talipus valgus. And the last one is the talipus equinovarus. So what is talipus equinus? In this, the foot is plantar flexed and the person walks on the toes with the heel raised. This is similar to that in the orsus. That's why it is called as talipus equinus. So in this case, the person walks on the toes with the heels raised. Next is the talipus calcaneus. In this, the person walks on the heel with the forefoot raised. So if the person walks on the toes, it is called as the talipus equinus. If the person walks on the heel, it is called as the talipus calcaneum. Talipus varus, in this the foot is inverted and adducted. the person walks on the outer border of the foot. So if the person walks on the outer border of the foot, it is called as the talipus varus. Okay, in this there is the foot is inverted and adducted. Whereas if the foot is everted and abducted and the person walks on the inner border of his toes, foot, it is called as the talipus valgus. So if this is an inversion deformity, it is varus. If it is an eversion deformity, it is called as the valgus. And last one is the talipus equinovarus. In this, the foot is inverted, adducted and plantar flexed. So you have three deformities here. The foot is inverted, adducted and plantar flexed. This is called as the talipus equinovarus, and this is the common presentation of the club foot. Next, coming to the third clinical case, a 55-year-old woman complained of pain on the plantar surface of her heel and on the medial aspect of foot. The pain became severe while beginning of the walk in the morning but disappeared after 5 to 10 minutes of rest. So the person has pain at the beginning of the walk but disappears after 5 to 10 minutes of rest after the activities. But however, it again reoccurred on walking after rest. So whenever the person is walking, she complains of pain and it disappears within 5 to 10 minutes after. On examination, there is a tenderness at the medial tubercle of the calcaneum and on the medial surface of this bone. The pain increased with the passive extension of the big toe and was further exacerbated by the dorsiflexion of the foot and or by the weight bearing. So when the person is asked, there is a tenderness in the medial tubercle of the calcaneum and on the medial surface of the bone, while passive extension of the big toe and further it increased on the dorsiflexion of the foot and the weight bearing. So on examination, radiological examination, an abnormal bony process protruding from the medial tubercle of the calcaneum was seen. So here you can see a abnormal bony protrusion from the medial tubercle of the calcaneum. So what is the provisional diagnosis and what is the cause of it? So this is plantar fasciitis. Plantar fasciitis is due to the inflammation of the plantar aponeurosis. The plantar aponeurosis is stretched during the standing position and it is seen in people who are standing for a long time or for walking for a long distance. It is particularly seen when a person is using inappropriate footwear. There is a pain and tenderness in the sole of the foot, especially underneath the heel during the standing. So the repeated attacks of plantar fasciitis leads to the calcification of the posterior attachment of the plantar aponeurosis, and this condition is called as the calcaneal spur. So the calcification of the posterior attachment of the plantar aponeurosis is called as the calcaneal spur. Next, coming to the fourth case, a 16-year-old boy twisted his right ankle while playing football. He came to the emergency department with severe pain and swelling around the ankle joint. On examination, there is swelling and tenderness over the lateral aspect of the ankle. X-ray showed no fracture or dislocation of the shoulder joint. So in this case, if you see, there is a ankle twisted and the person complains of severe pain and swelling around the ankle joint, and there's a tenderness over the lateral aspect of the ankle, but x-ray shows there is no fracture or dislocation of the ankle joint. So what is the provisional diagnosis? So this is called as ankle sprain. The excessive stretching or tearing of the ligaments of ankle joint is called as the ankle sprain. So what is the anatomical basis of this? When the plantar flex foot is excessively inverted, as in case of slipping from while playing, there is the anterior posterior talofibular ligament and the calcaneofibular ligament are stretched or torn. So this is the anterior talofibular ligament, this is the posterior talofibular ligament, and this is the calcaneofibular ligament. Now these three ligaments are present on the lateral aspect of the ankle joint. So if there is a injury to these ligaments, this is called as the sprain. So there are three types of sprain. In type 1, there is ligament stretched. So here you can see only the ligaments are stretched. Whereas in type 2, the ligaments are torn slightly. Whereas in type 3, the ligaments are completely torn. So these are the three types of sprain. In type 1, there is stretching. In type 2, partial tear. Whereas in type 3, there is a complete tear of the ligaments. Next, coming to the Pott's fracture. The fracture of the lower part of the fibula and the malleolus of the tibia with the outward displacement of foot is called as the Pott's fracture. So if there is a fracture of the lower end of the fibula and tibia, that is the medial malleolus and the lateral malleolus, it is called as the Pott's fracture. Whereas if there is a fracture of medial malleolus, lateral malleolus, and also the posterior margin of the tibia, it is called as the trimalleolar fracture or Cotton's fracture. So these are the two types of fractures we have to know. One is the Pott's fracture, which is bimalleolar, and the other one is the Cotton's fracture, which is the trimalleolar. So to summarize, today we had learnt about the uh, clinical anatomy of foot, mainly the plantar fasciitis, calcaneal spur, club foot, and also about the fracture and sprains of the ankle joint. Thank you.